Your name
Dr. Margaret Flowers.
and your professional position?
I am a pediatrician who's currently not practicing. I'm co-chair of the Maryland chapter of Physicians for a National Health Program and on the steering committee of the Leadership Conference for Guaranteed Health Care.
Okay. Now, you just testified before Senator Kennedy's committee on single payer. You were one of 23 people who will testify in this hearing. You're the only single payer advocate. Last month, you were arrested by Senator Baucus. So which do you prefer, being arrested or testifying?
I definitely prefer testifying. It's a little more comfortable. But the most important thing, and this is why we were protesting the last time, is that we need to have a seat at the table and have our voice not only heard, but recorded, written in the record, so that we can, have our say and people will see that it is there.
So give me your sense of how it went today. You were one of 10 or 12 people at the table, and so it went on for 3 hours.
Right.
What kind of impact did you have?
Well, I actually have to say I'm very appreciative that some of the senators welcomed me there, and Senator Dodd I felt was very fair. I was somewhat concerned that being the lone single-payer advocate that they would try to marginalize me and not allow me to speak, but they did allow me to speak. It was an interesting hearing because I was seated next to Ron Williams, who's the CEO of Aetna, who makes $28 million a year, not counting his 30-so million stock options. And so, of course, he and I definitely disagreed over, how health care should be paid for. But, they gave me a chance to speak, and I think it's a beginning.
How many single-payer supporters are there in the Senate?
Great question. Well, Senator Sanders and Senator Harkin, we could possibly say that Senator Brown is a supporter. There have been people who have said they support it in meetings, but won't actually sign on to the bill because they don't think it would get the votes. Senator Kennedy has been a single-payer supporter in the past.
Right, but in terms of, but only
one has co-sponsored. Well, no one's co-sponsored, only one bill.
Only one bill. And so why, for example, do you think, what did Senator Harkin tell you today about single-payer?
Well, he said it to my colleague who was there because Senator Harkin left early and basically said that he used to sell insurance and he understood that the more pools you have, the more it costs, and that 1,300 pools is very expensive, but one pool is affordable, and so he said single payer is the way to go.
Okay, and so I guess the follow-up for Senator Harkin is, why aren't you signed on?
Right.
Why isn't Sherrod Brown signed on? He also talked to you about signing on?
Oh, he sent me a note about support, and I haven't spoken to him, personally. I think he would definitely be another person that his constituents should go and speak to.
So is single payer on the table in the Senate now?
And I don't know if you saw the C-SPAN footage. I was at the end of the table. I didn't really have much of the table, so I think that's very symbolic of where we are. We're just starting to be at the table, but it's going to take a lot more pushing, a lot more grassroots movement, a lot more pressuring the senators before we actually have a full seat at the table.
Now, polls show that the majority of doctors favor single payer now. 10 years ago, that wasn't the case, but
right.
The AMA today came out and said it doesn't support single payer, doesn't even support a public option. How can that be if the majority of doctors support it?
Well, the AMA their membership only reflects about 30% of physicians nationwide, so they're not the majority of physicians. And I view them as being a more corporate, conservative type of body. To me, there were 4 physicians at that table today. One was from the American Enterprise, one was from Harvard, and then the one from the AMA, and myself. And I have the feeling that of the 4 physicians at the table today, I was the only one that believes that health care is a human right, and that's very disappointing. It's not reflective of most physicians.
Well, and the panel was not reflective of American public opinion.
Right.
What about President Obama? He said in 2003 he supported single payer. All we had to do was take the White House, the House, and the Senate. Mm-hmm. What are your thoughts on President Obama?
I'm disappointed. People are really looking for a change. This is such an opportunity right now to do the right thing, and I worked hard for his campaign, believing that he was going to be a leader and that he would come through for the people. And so I think my optimistic side believes that he still does understand that healthcare is a human right and single payer is the solution, and we need to push him and to give him the political cover through our grassroots movement so he can go in that direction.
So one last thing, is today the last day that single payer will be heard in the U.S. Senate, or do you think that in the coming hearings, single payer will have a place at the table?
We're going to continue to push for a presence at every hearing. I think that's the least that they can do. We've also, and I said it in my opening testimony, are asking for a full hearing on the merits of single payer in the Senate. If they actually want to have an open debate, an open discussion about what's best for this country in healthcare reform, we deserve at least one full hearing to discuss the merits of it. And we've also asked for scoring through the Congressional Budget Office of single payer.
Okay, so you raised scoring, I have to ask you, what would it show? What do you think it will show?
Well, we already have past studies, two by the Congressional Budget Office and one by the General Accounting Office, which showed that single payer saves money, that if we used our health care dollars right now that we're currently spending on a single payer system, we could provide health care to everybody. But not only that, we have numerous studies at the state level done by very reputable organizations, the Lewin Group and Mathematica. They consistently show that single payer saves money. And then if you look at other nations and look at what they spend to cover all of their people, it's just very consistent. Single payer is the only solution for healthcare reform in this country that will actually save money. And it's the most fiscally responsible. Not only that, it's the only universal one. It includes everybody, and it allows doctors and other healthcare providers to practice their profession again without interference from profit-making private insurers.
Thank you, Dr. Flowers.
Thank you.